Welcome to this month's webinar hosted by the Healthcare Leadership Academy. The Healthcare Leadership Academy is a social enterprise that delivers programs to equip healthcare professionals in the core areas of leadership, quality improvement, and management. Please visit our website at www.hlaafrica.org for more information about us. Earlier this month, we began a special webinar series tagged the PathFinder series, Advancing Leadership and Management in Healthcare, and we're excited to hold the second session in the series today. For today's session, we're excited to have a special guest joining us today, Dr. Mamsallah Faal-Omisore. Welcome. Dr. Mamsallah is an expert resource on clinical practice and medical education. She's a practicing family medicine physician whose current portfolio spans clinical practice, medical education, and health policy. She's also the clinical director of Primary Care International, a social enterprise that focuses on strengthening primary care worldwide. She previously worked as a GP principal, a general practitioner principal in the UK, providing primary health care to a multicultural population in inner city London. She then relocated to South Africa in 2008, where she pursued dual interest in infectious diseases and medical education. As a faculty presenter for the Medical Protection Society Education Services, she delivers workshops nationwide on risk management and communication in medical practice. Dr. Mamsallah, it's exciting to have you join us today. She will be sharing notable insights on the importance of advancing population management for sustainable and strengthened health systems. What is population health management and why is it so important for health system strengthening?
I think we probably need to break this question down into its components. I think to understand population health management, you first need to understand population health itself and what that means for the experience of health in general. And I'm sure for the health practitioners on this call, you'll recall that WHO in 1948 defined health as a state of complete physical, mental, and social health well-being, and not merely the absence of disease or infirmity. And this applies not just to the individual, but also to the population as a whole. So population health really focuses on the interrelated conditions and factors that influence the health of a population over the life course, so from birth to death. And it looks to identify systemic variations in the patterns and occurrences of those factors and applies that knowledge to develop and implement policies and actions that improve health and well-being for those populations. And in population health, that population could be anything. It could be, your clinic attenders. It could be patients on the ward. It could be people who live in the catchment area. It could be enrollees on the health insurance plan. It could be university students. But the idea is that you interrogate this population and try and understand their health determinants through population health resources and understanding in order to help you learn how to manage them. And that allows you, therefore, to design a strategy that ensures an improvement in the well-being of the population rather than the individual. And the main idea of this is to recognize that if you focus on the individual, then you're missing so much about what influences that individual's health. And if you can imagine that most of what influences our health actually lies outside of us. And in fact, people have narrowed down that figure to 70%. So 30% of what influences our health, we have control over. Those are sort of the individual factors. And 70% lie outside of us. So if we really want to make a difference to the health experience of individuals, and indeed populations, we need to start thinking bigger, better, greater, if we want to make a difference to people's outcomes. And so that's why I think population health is particularly important for health system strengthening and the way that we approach that.
Mm-hmm. Thank you, Dr. Mamsallah. 70% is quite a remarkable number. And when you were speaking, you spoke about vision and strategy, rather. Since these are very key components for sort of advancing population health management, what are the steps that leaders and organizations can take to develop their vision and strategy around, advancing population health management?
So I think that's some of the, it's just when I was sort of thinking about, you sort of asked me to think about vision and strategy and what that really means. And I sort of reflected on what health facilities write about their vision, and I want to encourage everybody on the call today to sort of, think about their own vision for their practice. Maybe look at other facilities and think about their own vision. But it's usually a headline statement, isn't it? It's something like, we want our people to live longer, better, fuller lives. We want to provide care to the standard that meets global standards. And those are visions. But how do you get there, right? So that is what strategy is about. So how do you get there? And there are two things really around strategy. It's about how you get there and what you do to get there. And how do you know when you've got there, right? And that's that's where population health management comes into its own, because everybody thinks that data and the management of data and the management of information that we have about patients and the way that we manage those factors and those influences around population belong with policymakers and belong with state and belong with the government, and actually don't recognize that in fact you have influence over some of those things, and that influence that you have can take you from deciding what your vision is and getting you to where your vision is. So it's really it really defines what your strategy is. And so what I say to people a lot is your vision is a forest, right? So, but you need to also understand the trees that go into that forest. And population health management allows you to straddle both. So you understand each individual patient as you go in, but you understand where that patient fits into the wider picture. And because you understand that, you are able to influence outcomes for patients, but even influence outcomes for yourself as a health provider who wants to meet a particular vision. So I would say that the steps include, we'll probably talk a lot about it in a little bit more detail, but it would include things like thinking about what your targets are with respect to achieving that vision. And often those targets are quantitative. Sometimes they're qualitative, but often they are quantitative. They could be, for 80% of our patients, we would like, say they've got hypertension, we would like to see 80% of our patients with hypertension to have optimal hypertension control, for example. And so population health management allows you to set yourself targets that help you define how you might achieve your strategy.
Thank you for that response. My next question is around coordination of care, and we see it as a critical piece of the population health management puzzle. What is coordination of care, and why is it so important, especially when one is operating in a low resource setting? And how can an organization better position themselves to provide, responsive and coordinated care?
Okay, I think the first thing, so I've talked about how population health management in effect provides us with evidence for how we might go about doing things and how we might achieve our strategy. But at its very basic, in terms of a health provider's perspective, it's really about providing the best care for your patient at least cost. And so for those of us who work in low resource settings, it's really an important, I suppose, strategy to take on board, that if you were to engage in population health management principles, then you are probably best placed at that point to deliver on the best care for your patient at least cost. Because the truth is that one of the greatest inefficiencies in healthcare delivery from an individual or population level is the lack of integration, or if you like, coordination. Let's go back to the patient that I spoke to you about earlier, patient with hypertension. At an individual level, you may see a patient with hypertension, right? That patient belongs to a subset of patients with hypertension that you know. And that subset of patients with hypertension belong to another subset of patients who have hypertension but don't know it. And then that group of patients who have hypertension but don't know it belong to another subset of people who are at risk of hypertension. And coordination of care means thinking about how each subset within a population can be affected and putting measures into place to minimize the impact of the disease for each subset so that the population as a whole benefits. So that means that interventions can be targeted according to the characteristics of that population that you're looking at. And in patients at risk that have not developed disease, their intervention could be around, well, how do we prevent you who has not developed a disease yet from getting the disease. And for those who have the disease but don't know it, then the intervention is about, well, how do we screen for the disease in you and start treating you early so you don't develop complications? And then for the people who are already having the disease and we know of them, how do we prevent complications? How do we give you your best life yet? So a good system with limited resources therefore aims to ensure that the most of their population remains as much as possible within the at-risk group. So try as much as possible to keep your patients as healthy as possible. Because actually what that means is that you spend less on managing very expensive conditions and the patients are happier and healthier. And where they're possible, there are opportunities for early screening in the lifetime of the disease. This means cheaper and easier to manage conditions because you've caught it early. And then that way you're spending less even in management. And what you're aiming to do really in population health management is to try and ensure that as much as possible, the population that you look after are well, are easier to manage, are cheaper to manage. And you're keeping the patients with the really complicated versions of any particular condition to as low a proportion of the population in total as possible. And understanding population health is central to achieving this. So in general, when people talk about population health management, when they're talking about health systems, when they're talking about supporting countries or institutions or organizations or even districts or regions, everybody talks about how we can prevent, how we can screen early so that cost is less. And for a low resource setting, that has to be the way forward.
Thank you. An element of the question I would like to just, reiterate is, how can an organization better position themselves to provide, responsive care? What are there practical tips that you can, recommend for? Yes.
Yeah, I think the first and most important tip, I think, is to understand who's your population, who is the population that you serve. And the best way to understand that really is to get the data. There's nothing that influences what you do and how you do it more than the information that you have around the care that you provide. And getting information and data would, I think, be the best key step, because with data, you can understand your population. With data, you can understand which subsets the population fits in. With data, you can think about that vision and think about the outcomes you're interested in and think about the data that can influence that outcomes and how to measure it. So I would say that to make yourself able to do population health management well, you'd have to be able to measure what you're doing, because without measuring, you can't know. And without knowing, you can't make any decisions. And decisions have to be based on evidence. Any decision that is not based on evidence has a high likelihood of failure. So I think the key thing, really, the key message is that you do need to measure. And investing in measurement, maybe resource intensive initially, but always pays off.
Well, that's very insightful. Thank you. Well, I will know that most healthcare providers want to provide the best services to the communities they serve, and you made mention of that in your example about some of the vision statements of most healthcare facilities. There are often some economic constraints that make this difficult. Can you speak briefly about how to manage population health and still remain financially viable?
Okay. I think, I've alluded to this earlier a little bit, one of them obviously being data, but inefficiencies in resources are an essential part of why population health management should make sense for health care providers. With limited resources, you need to understand your population's needs, and so you can better use your resources. So in practice, what does this mean? We talked a little bit earlier about health system strengthening, so I just want to bring that back into the discussion. Health system strengthening looks at how a system can function well to meet its needs. And there are various lenses by which the health systems are looked at, and what we call the WHO building blocks of health system strengthening, one of the ways of looking at it. And they'll look at things like resources. So in terms of service delivery, what services are you providing? Can you start thinking about whether you should be a primary care provider or secondary care provider, or both? Looking at your population, should you be focused on primary care? Secondary care is quite expensive. You might be better off providing primary care at lower cost, but a wider population group. So that's one aspect that you could think about, again, using those building block lenses. The other aspect you might want to think about is how you use your resources, your human resources. Increasingly people are talking about how you task shift, what we call task shift within the healthcare system. So task shift within your health facility. Healthcare assistants, nurses, pharmacists are doing much more clinical work. How can they be used much more efficiently and effectively so that your much more expensive staff can be used better? And that then brings some economic thinking around your expenditure on your staff resources. I talked about data. I mean, that's really key, because there is no way, or for example, even understanding what your task mix is can't happen, and how much you spend on your staff can't happen unless you're collecting data around, who you have, how many hours they put in, what are the roles that they do, how much do you spend on staff, how would you like to change that? Do you want to spend less on staff to reduce your overhead costs, but at the same time improve care? You can't do any of that without some kind of robust data collection mechanism. So information systems around healthcare are key, and that's one of the building blocks of the health systems, and in fact should be a primary investment as it defines every other activity. The other aspect, of course, is leadership. As a healthcare provider, you want to make sure that there's some level of leadership. Who drives the decision making? Who decides what are the strategies that we should follow? Who disseminates that strategy within the health provider? How do you communicate it? How do you get the buy-in from the rest of the staff? And how do you bring about a boldness that introduces a culture of data-driven activity? How do you govern what happens within the health facility? Who are the people who ensure that everybody is on board? And all of these things are important. So I would say that I agree that there are economic constraints to achieving population health management, but already, just in this conversation alone, I've sort of alluded to the importance of data that influences everything that you think about. And some of the things that you can think about, which are things like service delivery, which are things like your task mix, and who does the work, and can they do more or can they do different in order to improve what you do. So in short, what we are truly trying to say is that what you need to do is use your data, identify care gaps, decide what you're going to do, how you're going to intervene, monitor it, and continue to measure that to meet all these building blocks that are important for a health system to improve and to demonstrate that they're doing population health management.
That's very well-rounded response. Thank you, Dr. Mamsallah. And just to sort of circle back, you spoke about leadership being such a core component or element, for data collection. Are there other tips, that you can share around strengthening the data collection process itself, the quality and the quantity, as it were?
Yeah, so important. So it's important then to start thinking about, well, why is it important? I mean, we've talked about some of the issues that, some of the things that you can influence. Well, the truth is that actually we're collecting information daily from our activities with patients. But I would say that data is probably driven to meet a financial need, often for most of us. So things like billing, maybe watching pharmacy stock, maybe watching consumable stock, that kind of thing, maybe watching footfall, because that translates to how much you earn. But we could do so much more with that data. So for the audience that are listening, I have a few questions for you to think about before you leave today. before you leave and even beyond, just think about what health data your organization collects. Is the health data that you're collecting for the local health authorities, national health authorities? Have you used any of the data that is being collected by government or local or national to change how you deliver care? Because that's a lost resource already. So already that's one tip. What data are you collecting and how can you use that to improve your patient's outcomes? Something to think about, because we don't want to reinvent the wheel. What people hate most is having to collect data all the time but not know why they're collecting data. So the first thing is what data you collect and can you use it? The second thing is think about how you can communicate why you're collecting data to your staff, because that makes a difference. Because a lot of barriers to what we do with data is because people don't understand why. They don't understand how it impacts what they do. They don't understand how it influences their own work, but also more importantly, patient care. So really important to emphasize that to start. And remember that there are different types of data as well. So that's the other thing that you need to think about. I mean, I've already alluded to the fact that we collect data for financial purposes. So there's a lot of administrative data around, and that is fine, but it's not detailed enough to evaluate and measure the quality of care. And sometimes it's inconsistent, subject to misinterpretation, and does not adequately reflect performance. And data for improving care needs to be fair, needs to be accurate, needs to be robust. And the health status data that we collect from patients, I think, reflects what we are hoping to do, which is to deliver the best care for patients at least cost. So data around health status, data around health outcome are really important. And then comparing that data with what it costs to deliver what you can call a unit of care to a patient, and making sure that you're delivering that unit of care effectively. So you're matching the care outcome for the patient as well as the unit of care to make sure that you're doing your best with the finances that you have. And health status data does that. Another aspect of data that you might want to start thinking about collecting is patient experience data. Because it's one thing to say that, I'm able to, improve hypertension care for most of my patients. But if your patients are not experiencing satisfaction with the care that they receive, then as a private provider, for example, that means that you have challenges in retaining the patients and you want to make sure that they're satisfied with their care. So it may be useful to you to collect patient satisfaction data in order to improve the kind of care that you provide. And so it's important to think about all of these things. Think about how comprehensive your data is. And we talked about the fact that it's not only administrative, but it has to be health status data. You might want to think about patient satisfaction data and whether you collect patient-related outcomes, because the quality, integrity, accuracy, and reliability of our data relies on all of this. And the broader the data elements we collect, the more information we can gather. But there's always a but. This is time and resource intensive. So you can limit the data collection to outcomes of that are of particular interest of you. And you can link those outcomes of interest to your vision and your strategy. And there are many tools that can assist with this, that are freely and openly available. WHO has many tools around data collection for primary care, for example, non-communicable diseases. You might want to look into these. The Primary Healthcare Performance Initiative has a lot of useful units of data for those who are involved, particularly in patients with chronic diseases. There's also the International Consortium on Health Outcomes Management, and they also have some useful data around patient satisfaction. So if this is something that you're particularly interested in, you can certainly work with some of these organizations in terms of the freely available tools to develop your own data of elements for your own outcome of interest. The most important thing, though, is to start with what you do already and see how this can be used or adapted.
Thank you very much. That's been very informative. A lot of food for thought right there. We have a question here. Thank you everyone for sending in your questions. One of the questions here says, what is the link, if any, between public health and population health? Are we able to link them at all, or is this a new field on its own? Thank you, Godwin.
It's a good question. So it's a good question. I think you can consider it as a Venn diagram. So there's an overlap. Population health, I think, looks at, and I'll just remind everybody, looks at the influences and the determinants that influence a defined population, or whatever that population might be, to look at the patterns of those influences and determinants and how that influence the population's experience of health. So the key thing here is that it's defined. Whereas public health looks at the broader population as a whole, it could be national population, regional, could be global, and looks again at the influences and determinants, but also other things around, the epidemiology and the statistics of how health is affected, and interventions that are at a broader level, usually global, regional, rather than a defined population level. So I would say that a population health is, in its simplest form, a microcosm of public health, because it is defined by the population of interest for you. So for you as a healthcare provider, that would be your catchment population, or it could be, like I said earlier, your HMO enrollee population for a specific HMO. You might have outcomes of interest for that specific HMO, and you want to do some population health management for that specific HMO. So that's the difference.
Thank you for the clarification. Godwin, I believe that your question has been answered. One last question, Dr. Mamsallah. You alluded to your work with the HLA at the start of this conversation, and you said that you've been a member of the faculty for a couple of years now, and you're also faculty for the upcoming Healthcare Executives Leadership Program. Can you please share more about the population health management module that you developed and what participants stand to gain by enrolling in the program?
Yeah, gladly. I think that it's, one of the most difficult, the program is fantastic because it covers so many aspects of leadership with respect to patient care, and it absolutely influences and changes a health provider's perspective of their role in how they can impact people's lives, even before they experience ill health. As I said to you, health is everything at all times for all people in a way. So firstly, I would say that the whole program is a great resource for people, and I would encourage, if you've not registered already, to certainly do so. Cover everything from sort of health financing to quality improvement, and of course, population health. From the population health perspective, and I've alluded to that area, I think that one of the things as a health provider happens is that we're very much focused on the sort of individual patient load, right? We're focused on meeting those immediate needs. And there's a lot of inefficiency in how we do that. And as we become more aware of the importance of being much more efficient, both for ourselves as going concerns, and we want to be viable, but also for patients, we need to start thinking about being less individual patient focused and much more, as I said earlier, helicopter view or forest view focused, because we have a vision. And as I said earlier, we need to have strategies that we put in place. We need to set ourselves targets. We need to measure so we can meet those targets in order to meet that vision. So the population health management module is a foundational in the sense that it talks about the importance of evidence for decision making. It focuses on the improvement of population and not individual. It talks about how you can invest upstream so that you keep people as healthy as possible, which I think for some people is concerning, because it means that the more healthy the population, the less they'll have in terms of engagement, whereas the converse has been shown to be the case all over the world. And I'll give you an example. For example, in the US now, as you know, they have a very much a health insurance-based model of healthcare, and they talk about the concept of value-based healthcare. And in value-based healthcare, what they talk about is that they want to, that thing about wanting to keep the patient as healthy as possible, providing the best care at least cost. And that's looking at the quality of care, right? And not the quantity of care, because they see the patient's experience as not just that one time when they come in, but the total of the times that they have come in. And the total of the times means that we want to make that total of time that they've come in as it adds up to something of quality, because then that means that the patient continues to engage, the patient trusts the care that you provide, and in the long term, that means that we are more likely to be viable. So people are beginning to be remunerated on patient-related outcomes rather than individual engagements around a particular disease. The other thing about population health is that it addresses determinants of health, which are important for settings such as ours, where cost of health is the cost of managing disease impoverishes people. And one of the things that we want to think about is to think about, well, what are the things that can influence how people experience health? And population health helps us to understand that. Are there other things that we can do apart from, getting people to have blood tests or getting people to buy medication? Are there other things that we can do that influences whether that person stays healthy or not? The other thing is that it recognizes, for example, that you as a health provider sit in a sector of your own, but you have collaboration with everybody else, and you begin to understand the role of how people's education influences what they do, the role of finance, the role of labor, the role of other, agriculture sector, the food and beverage sector, and how that influences. And as we begin to think about some of those things, then there's opportunity for cross-collaboration across various sectors. And for those of you who get to the stage where you want to be advocates for improving the experience of your population, then that's the level at which you can begin to influence policy around how people experience health. And then finally, I think the bottom line is around the fact that population health management drives people to think about data and how data drives everything that they do. Because in order to demonstrate improvement, in order to show achievement, in order to show whether what you've put in place has made a difference, you've got to be able to collect the information and you've got to be able to evaluate the information. And so the module helps you to understand all these key elements around population health management. And even if you don't use it immediately, there are aspects of it that you will continue to use throughout your career in health management and health provision.
Amazing. Thank you for expounding on the benefits of the HELP program, the population management module. Thank you so much, Dr. Mamsallah, for this very insightful conversation.